So the liver is the main organ which is producing a lot of proteins. If you remember about the plasma protein, the abundant protein is albumin, and the main function of albumin is, so it is called, yes, oncotic pressure, or we can call it as colloid osmotic pressure. What is the function? It is holding the water particle in or within the intravascular compartment. So when you don't have this protein, you are going to lose water into the interstitium. This is called as what type of edema? Hypooncotic edema. So you develop edema. One of the mechanisms of development of edema in case of liver disease is also hypooncotic edema. So for example, I am asking what is the mechanism of development in ankle edema. One is hypooncotic. Ascites, one is hypooncotic edema. Is it clear? Think about other proteins produced by liver. Clotting factors, yes, complements, and other transport proteins. For example, like ceruloplasmin or transferrin, all of them are what? Globulin. They are alpha and beta globulins. Except for gamma globulins, almost all proteins are synthesized by liver. So if you take plasma, you take all the protein except for gamma globulin. What is gamma globulin? Immunoglobulin. They are produced by plasma cells. So they are produced by something else. Except for these gamma globulins, all others are produced by liver. So you have problem with the liver, either functional deficiency or there is going to be morphologic deficiency. You are going to develop synthetic dysfunction. So you will have hypoalbuminemia, and you are going to develop also hypocoagulation. You tend to bleed. Why? Because you are not producing enough amount of, yes, clotting factors. You can develop infection. You can develop other syndromes connected to what? Deficiency of transport proteins. Is it clear? We are not going into very much of details right now. You don't need them. So if they ask you a question, what is the mechanism of easy bruising? So this is what? Decrease synthesis of clotting factors. You can bruise.